right around the year 2000, more and more Hispanics, of course, coming into town, and she noticed, and was wondering, it's so difficult for Americans without health insurance to get health care. How much more difficult must it be if you're Hispanic, you don't speak the language, you don't really understand our medical infrastructure, you may not be documented. That must be very, very challenging. So she started doing some research. How are Hispanics getting health care? Back then, they just weren't. It wasn't unless it's an emergency situation, they weren't going to doctors or anything like that. So with that in mind, she formed Cahaba Valley Healthcare. She didn't really have any knowledge of nonprofits or how to do it, but she assembled some of her friends, some coworkers, some people she went to church with, a lot of people in the medical profession. She got them together. She said, "I have this dream. We're going to do health clinics for Hispanics." They asked, "Well, what are you going to do?" She said, "Well, we'll just do some blood pressure, some glucose, stuff like that." And of course, the question there was, well, what happens then if you check the blood pressure and it's sky high or glucose is way off? Then what are you going to do? No real answer. And so in that question right there is kind of, we call that the tent pole of Cahaba Valley Healthcare. And then we're not going to do anything where we don't have that follow-up piece worked out. A few years ago, like Julie was saying, we started doing blood pressure. We started checking blood pressure. Well, as you may or may not know, it's very simple to check the blood pressure. All you just need is a little cuff, a little machine, and you can hook somebody up and instantly get their blood pressure. What took us so long to begin doing it was we needed that referral piece worked out for every single person who came to our clinic, no matter where they lived, no matter how much, if they had money, if they didn't have money, if they were documented or undocumented. We had to have a place to send them if they had high blood pressure. So that's what took us so long to get that blood pressure piece going. So we had to have that referral piece worked out. But anyway, back to where we were. We did start that way. We started basically with vision care. We did that for several years, doing these church screenings. People would come in basically in need of glasses. We had several programs at the time to get glasses. We then grew from there into dental care. Our dental care has basically been the biggest part of what we do now. But like I said, the need is so huge. It really is massive. And we're very, very blessed with a large amount of volunteer dentists and oral surgeons that without them we just could not do this because it's absolutely a huge, huge need. Do you have any questions? Go ahead.
Who do y'all refer these patients to, like high blood pressure?
With the high blood pressure, it's depending on where they are, where they live. We have several individual doctors who will see our patients. Of course, Cooper Green will see our patients. The health department also in Shelby County will see our patients. It's just a situation. It's really specific on what their patient's individual situation is. Like I said, regarding money, where they live, what sort of access to the care that they already have. And another reason that we got into blood pressure was it's such an integral part of your health, especially with dental care. We can't necessarily do any work on you if you have that high blood pressure because the different procedures, the different drugs we have to take to do the dental care very negatively react if you have high blood pressure. So it's just kind of a natural thing for us to do. We're excited. This year has been a big, big year for us. We've officially are now a United Way partner. That's or United Way agency. That's a really big deal. I think it's of course they fund us now. They're about 20% of our budget. But they, in addition to that, I think especially with a nonprofit like us, we're so small and we're young. It's just a credibility thing with United Way. People know that once they get on board, we become more of a credible organization. That's just really big news. And then the other big great thing that's happened to us is we're moving. Our dental clinic runs out of a dental trailer. The trailer stays still. It doesn't move. It sits behind our office. And we've been doing that for the past 3 years, which is great, but it's very cramped. It's very tight. And a dentist, Kevin Sims, I don't know if any you know him, he had a lease on a space over off Valleydale Road, and he had to move out, but his lease stayed with him. So he is donating his office to us for 2 years, rent-free. So we're just extremely excited about that. We've got 4 actual dental rooms and a room to do x-rays. And so we're just extremely excited about that. So that's really, really good news for us.
What ages do you serve? I mean, all ages?
We will serve all ages. Here's what the thing that we focus on when we talk about ages. There are so many organizations in town that will already see specifically children. On the, a lot of the health departments will, on the vision side of things, Sight Savers will. So when we have a child, we try to send them to one of those places because they're already, equipped to see the kids. And that then frees up a space for an adult who doesn't have anywhere else to go. So we'll certainly see children, but we do, adults are where we do most of our stuff because, like I said, there's just nowhere else for those adults to go. And the children, they generally have a place, and of course they don't. We absolutely do a lot of work on them.
You mentioned that you only see patients from Jefferson and Shelby County.
Uh-huh.
Can you tell why that?
That's just how we started. We had to start somewhere, and we've talked about growing out from that, but the need is so huge that we had to pick a place, and that's where we wanted to focus on. All of our churches are in Jefferson or Shelby County, and so that's where we focus on. But the need outside of there is huge. We get calls all the time from places that they absolutely need the care. But the other restriction, I don't know if I mentioned, is that we can only see 55 people per screen, and that's really, really hard. That's basically because we're there at the afternoon of Sunday afternoon. I mean, we start after church, we get out before Sunday night church, and that's as many as we can see in that time. It's just heartbreaking. We're turning people away at every screening now because we see the 55. And then we just,
Do they have to sign up in advance?
No, we don't. We actually, no, we don't. It's first come, first serve. Yeah, and it absolutely is first come, first serve.
And do you find that you pretty well have your afternoons full?
Yes, we're never under the 55. Yeah, we stay there all afternoon. We are absolutely packed. The only thing we can do, we will sit down with the people that we have to turn away and just kind of, are you here for an emergency reason? Especially on the dental side of things, people have abscess, which is of course an infection, and that can become very, very serious. So we will make sure that people go get antibiotics, or even had to write them with a prescription. A lot of places, I think Publix, I think they're like $1, and Walmart's free, or vice versa, something like that. So, it's very easy.
How do they go about finding out if they qualify, or what are your...
There's, and I should have talked, that leads me a little bit to funding real quick. We don't accept any government money. We're all private foundations, individuals, and churches. So we can set our own rules as far as that goes. When they come to a screening, we do want to make sure that they live in Jefferson or Shelby County.
So you have to have proof of...
We're going to take your word. We really are. When you come to a screening, we're going to take your word. Because all we're going to do there, like I said, is have the doctors examine. Just examine you. Now, if they find something more serious and we have to refer you to a clinic where we're going to do some actual in-depth work, then we're going to get a little bit more in your business. Make sure that you are Jefferson or Shelby County. Make sure that you can't afford this any other way. We're going to ask some income verification questions about you. And I'm sure that we've had people lie to us, but we're not, we're not a government agency that's, running background checks on you to make sure you're as poor as you say you are. You live really where you live, things like that. So but to answer your question, it's really just more of a conversation. We will have you fill out a form.
Do people line up like hours and hours before?
Yes.
Like the night before?
No, not the night before. We've never had that either. But we have, because we all go to church on Sunday mornings, and we'll go to go to church and then go to our screening, and you'll see the line. And of course, we're in contact with the preachers. And of course, the church obviously knows we're coming, and we've said you're going to have this huge line, and they know how to work with us. Most of the churches we go to every year, so they're experienced with that. We deal with churches. One of the ways we target Hispanic communities, we deal with churches with Hispanic congregations. So usually there's a Hispanic pastor, and we kind of make him the person to be in charge of that before we show up. But yeah, there's a lot, and it's
How frequently do you find a severe problem?
there's every clinic, every screen. Yeah, it's there's you know, I was at a nonprofit convention, I guess, at Bluff Park United Methodist Church, and I was just talking about highway health care, talking to their members about what we do, and we had one of the Brother Brian Mission was there, and I believe it's for homeless men. I'm not exactly sure what they do, but their organization was there, and one of the board members came up and said, "I just want to tell you that one of our guys was there. He needed some dental care. We knew about you guys. We sent him over to you guys. He just needed a tooth pulled. He had a toothache or something. But when he came, he got his blood pressure checked. Realized that was sky high. You guys referred him to a specialist to get that worked on. There was a situation that a few steps later, and I don't know exactly what the problem. He had severe problems, life-threatening problems, and that's just a Sunday afternoon. I mean, it is because the patients can't access it anywhere. They let it go, and they can't afford it, and it just gets out of hand very, very fast. So it really is on it. It's every afternoon, every Sunday afternoon.
Do you still screen for diabetes too?
No, we don't screen about it. We'd love to. Internal medicine is something, you know, our growth plan is to grow to see more dental and vision patients. Down the road, I imagine we will get to more internal medicine things. The problem with diabetes, like I said earlier, is until we have that referral process, you know, we don't want to tell anyone, you know, you might be a diabetic, but not have any, you know, not have anything to tell them. And if they're a certain person and they're not documented, they don't have any money, there's still those that just completely fall through the cracks. Of course, until they get the they have to rush to the emergency. You know how that works.
Are there similar organizations in other regions of the state?
As far as free dental care, Empower, that's free dental care. Of course, but you talk about other areas of the state, not to my knowledge. Not to my knowledge. I'm trying to think. Empower, I know that's free dental care. Jamie, I know. Can you think of anyone else? I don't know of anyone else that does free dental care besides us and Empower.
How can you use volunteers?
Volunteers, we can use all types of volunteers. Our huge need, of course, is the dentist and eye doctors. That's a big, big need. But volunteers do everything on the screen. We'll see 55 people, and we'll sometimes have 30, 35 volunteers. You'll do anything. You can do crowd control. You can help volunteers check in. You can do blood pressure. You can assist the dentist. You can assist the eye doctors. You can do all the different education pieces that I talked about. Nutrition education, dental education, vision education. You can help the patients fill out forms. If you don't speak Spanish, perfectly okay, because a lot of our patients aren't Hispanic. Depending on where we are, it could be close to 50%. So it's not a situation you absolutely have to speak Spanish. Most of the guys come out. Any other questions? I think I've covered everything.